Mental health problems are the leading health concern for young people in countries like India today. And this challenge is both on the demand and the supply side. So, for example, challenges or barriers like stigma really get in the way of people accessing help. But on the supply side, there's a huge shortage of mental health professionals who can actually cater to the need.
So if you look at the mental health care gap in India's context, conventionally we've always looked at it in terms of the treatment gap, which focuses on curative psychiatric interventions. However, that is a limiting approach because it focuses on a biomedical approach which ignores the other socio-economic aspects that influence mental health. And hence, in India's context, when we talk of the mental health care gap, we also have to look at both physical health, which is also a very important aspect of mental health, but also psychosocial support and care, which touches upon the various other dimensions or the factors that lead to mental health challenges in an individual's life.
There has been tremendous work in the last decade in particular on advocacy, awareness, education on mental health and mental illness. Within this space, there is also tremendous opportunity for innovation, both for how we reach people with this information and also methods of translating and relaying this information.
One of the fortunate aspects of our professional work in this sector has been our interactions with some really exemplary individuals and institutions who work in the space of mental health. Some of these in India are our close partners such as Sangat and the Center for Mental Health Law and Policy. And internationally, we've been actively working with the Wellcome Trust and Comic Relief, for example. And the great part about working with organizations and as well as the individuals who work in them is that they bring a high level of expertise and incisive thinking in their disciplines to this topic. Design and design thinking has a very important role to play beyond the design of communications and so on. And that role is really to be this kind of like a connective tissue between different ways of thinking that these institutions and expertise represent.
So as research practitioners, one of the challenges of centering lived experience in our work is the fact that we're actually not trained to listen. And I think that design thinking is a process of facilitated listening or engaged listening, where through various methodologies and tools, we can actually break down the qualitative experiences of the individuals or communities that we work with, and then design specific elements of those interventions and solutions which address those specific needs.
A lot of our work, therefore, has shifted, especially in the context of mental health, towards identifying new types of tools, methodologies, and approaches that might help these lived experiences become the epicenter around which innovation happens. But at the heart of it, it's a very simple idea that can you create a platform for interaction with a citizen in a way that they're able to feel free and able to express some of their inner thoughts about the everyday experience of mental health.
It's not always easy to talk openly about our mental health, both our struggles and our victories. But when we do, we let others know that they are not alone. Sharing our stories with others can inspire them, offer hope, and help them. So Man Mela, which means Museum of the Mind or Festival of the Mind, was a project that built on some of our work on mental health storytelling. And this is a website that contains long-form mixed media stories of young people's experiences of navigating different kinds of mental health challenges. And alongside these stories are presented psychoeducation materials in both video as well as handout format. These are open access, anyone can use them, download them, or adapt them.
Man Mela's storytelling process as well as its museum of stories. For when it was published was a very novel storytelling intervention. I don't think anything similar to it existed in India, but also possibly elsewhere, where individuals could come forward, work very collaboratively with artists and designers and technologists to share their own health narrative and their mental health narrative and have it published.
We identified contributors with diverse mental health experiences, with diverse identities and backgrounds. For example, we had a queer man from Imphal talking about his experience navigating substance abuse and suicidal ideation. We had a woman talking about navigating her Muslim identity and mental health. We had someone who was also a caregiver for her mother and was navigating her own mental health.
I would say we were already very convinced with how people's stories have the power to change hearts and minds. But the format that these stories are presented in also really matters to, is it kind of giving you the right amount of information? Is it generating hopefulness? Is it also sharing strategies around how to manage difficult mental health difficulties? So Quicksand was involved very, very early on in Manmela from sort of conceptualizing how we would collect these narratives. One of their first activities was conducting ethnographic research at 5 of the cities where the narratives were being collected from. And what they did was actually make field visits, home visits, go and talk and learn from the prospective contributors. What did their daily life look like? What would telling their story look like? Would it really reflect the kind of cultural background that they came from? So working with young people in each of those cities to really understand what does the sort of social makeup of that city or that context look like. They brought that creative ethnographic design perspective, which was then matched with the clinical and the research perspective here, and it made, I would say, a really good and kind of holistic working group to develop a project like this one.
What was quite amazing about this process was how it navigated the otherwise very complicated questions around consent, confidentiality, anonymity. If I were sharing my story, I would have had a lot of autonomy and choice around how I wanted to be represented. I could have, like in one of the stories, be a shape, in another story, a very lifelike portrait. And I think giving that sense of both, agency and responsibility to the story contributor was a hugely empowering experience for each of the story contributors that we worked with.
Visual storytelling is an extremely potent medium to tell difficult stories in sensitive ways. We can use visual metaphors, colors, just the way a page is composed to evoke a feeling in the audience and create empathy in the audience and represent these lived experiences.
So Manmela is now about 5 years old, and I would say the thing that I'm most proud of is that the content on that platform has really stood the test of time. The resources, in fact, are actually used by university students. They're used in teaching and training. And the stories themselves are something that when people see it, it motivates them to want to tell their own story. And it also motivates people to want to seek help, or it's changing how they think about mental health and their understanding of mental health. And those are really the things I would say that we are the most proud of.
As a software developer, I had a very simple way of explaining my thoughts of suicide and depression to my friends. It's like a background process that keeps running in my mind, trying to convince me that I don't deserve to live. It tells me that no one loves me and the world would be better off without me. And it keeps showing me incidents of past where I was bullied and rejected in order to convince me that I don't deserve to live and I'm worthless.
So Outlive was thought of as a youth suicide prevention program specifically for urban youth between the ages of 18 to 24. And it comprises of 3 distinct interventions. The first looks at a public engagement campaign to increase awareness and destigmatize youth suicide prevention. The second looks at facilitating peer support services for young people through a chat-based app where young people are trained to provide crisis support to others who might be in distress. And the third focuses on building capacities of youth leaders and youth advocates to engage with policy makers to drive systemic changes for youth suicide prevention.
Current research in the sector suggests that young people feel much more comfortable talking about suicide and self-harm on online channels, and that too with peers. However, at the same time, there is a huge scarcity of peers who are willing to give this kind of a topic their time and commitment.
Peer support is an evidence-based intervention for providing mental health and suicide prevention support. Outlive Chat was developed based on this premise to train young people or youth volunteers in colleges and community-based organizations to provide chat-based peer support to young people who might be in distress or might be having thoughts of ending their life.
We went through a lot of iterations of the platform to understand the various technological choices we had, as well as where on the spectrum of privacy did we want to lie. Equally important were the communication design elements that came through an iterative process of participating with experts and with young people.
So we worked with Quicksand over a period of 1.5 years to develop the Outlive Chat web app. The primary feature is for a young person to connect with a trained peer supporter who will provide them support, specifically crisis support, if this young person is having thoughts or plans of attempting suicide. So one of the things that we spent a lot of time thinking about with Quicksand was just the design interface of the app. How can we make the journey from entering the app all the way to actually getting in touch with a peer supporter seamless and reduce the number of steps between that whole process. We also spent a lot of time thinking about how to make this app anonymous because we were very clear that the anonymity of both the peer supporter and the young person who's receiving support needs to be maintained to ensure their safety and security. So we've been implementing Outlive Chat for over a year now, and we've provided support to over 1,200 young people who have been in distress or experiencing mental health problems or have also had thoughts of attempting suicide. Outlive Chat is currently a pilot program, and as we move forward, we hope to scale this up across different cities in India. We hope to integrate Outlive Chat in colleges with community-based organizations and other youth-based platforms. We also hope to increase access to young people across different demographics, specifically those living in underserved settings in cities or who don't have access to information or resources on youth suicide prevention.
Creating a suicide prevention platform comes with its fair share of challenges as well. One of these challenges is that of institutional uptake as well as government and state support, which are essential for scaling up these efforts. Part of that challenge is up to people like me who will bring our design expertise to create outcomes that can be scaled. And part of that challenge has to lie with scientists as well as with non-profits and experts who work in this space.
मेरा नाम नीतू है। मैं रोहिणी दिल्ली में रहती हूँ। मेरा प्यारा बेटा वैभव, जिसे मेरे पड़ोस में सभी जानते हैं।
मैं श्रीमती हेमा देवी हूँ, जो कि वैभव की नानी हूँ।
जब मेरा वैभव 2 साल का था तो एक दिन उनके पापा ने मुझे कहा कि नीतू, ऐसा नहीं लगता कि वैभव के विकास की गति कुछ दूसरे बच्चों से अलग है। उनकी कही बात मेरे मन में शक का एक बीज बो गई। मुझे लगा कि कहीं कोई गलती गर्भावस्था के दौरान मुझसे हुई हो या दूध पिलाने के समय हुई हो, और मैंने वैभव के विकास पर गौर करना शुरू किया। फिर हम दोनों ने डिसाइड किया कि हम अपने आसपास के आंगनवाड़ी कार्यकर्ता से मिलेंगे।
Namaste is a 5-year program that aims to implement a flexible detection and care pathway for children with neurodevelopmental disabilities in India, Nepal, and Sri Lanka. This was quite a new area of work for both Quicksand and Sangat, where we were not just designing for services, but we were looking to create products that would support the uptake of services and interventions in the community. We were aiming to develop materials and resources that fall within the remit of patient education and health information to be able to support caregivers to make correct decisions.
What therefore needed to be done was to provide information in order to hopefully encourage parents to seek care, treatment and early intervention as quickly as possible. The reality unfortunately persists today, where it is still very, very challenging to access this healthcare. It can be either very expensive, very limited, or frankly, inaccessible for many.
The Community Engagement Toolkit finally consists of 9 discrete materials that aim to build awareness about common signs of delayed development in children in the early years. They consist of materials and information that are relevant for a caregiver when a diagnosis is made or when a delay is detected. And finally, to support them and help them engage with interventions that are being provided. A distinct feature of this toolkit is that it also consists of videos and voices of caregivers who have children living with neurodevelopmental disorders. And these videos are aimed to both bring a sense of hope for the caregiver as well as help them make decisions about their child's care at various points. A unique part of the Community Engagement Toolkit is a child development milestone calendar. It also engages all members of the family, so it's not just for the parents, and gives both parenting tips as well as very clear practical information about what to do in case your child is missing certain developmental milestones.
For countries like India, where healthcare systems are often very stretched and typically have major shortages for specialists, or in this case, say mental health specialists, projects like Namaste or Manmela have a very, very important role to play. They are grounded in task sharing approaches that simply means the burden of care and the burden of providing services is shared also by lay people, or is more dispersed so as to reduce the burden on the formal or institutional healthcare system.
So innovative solutions that bring research and design together really have the potential to be creative options for low-cost solutions to actually reduce the burden on the mental health care system. I think using design methods has made our innovations much more sensitive, culturally and contextually congruent with the settings where we work.
Disciplines like design, specifically human-centered design, offer an invaluable method and window into what it is exactly that the needs, challenges and experiences of humans are.
The future promises to be very complex. Mental health promises to be even more complex. My hope for Quicksand and the design practice as a whole, that we would be able to provide tools and strategies that can reduce that complexity. I also hope that we would be able to bring institutions and governments on the same playing field as citizens, where a safe space can be established for all their voices together.